Sometimes getting up in the middle of the night to void can be sometimes simple as looking at your caffeine intake, whether you drink a lot after supper, whether you don't drink throughout the day and sometimes save it for the supper. Getting up in the middle of the night is no reason not to drink, which sometimes patients have a tendency not to drink. Everybody needs to have a certain amount of fluid intake per day, and we do recommend to all our patients you should drink at least 1.5 liters, 2 liters a day to keep your kidneys flushed and for overall generalized health. Sometimes, you might be on a medication with side effects that causes you to get up in the middle of the night, so sometimes we have to review that. If you take a diuretic, are you taking it at the appropriate time? Sometimes it's better to take it in the morning as opposed to the nighttime because it'll start to work in the middle of the night and you have that urgency to go void. Also, because we are very sleepy at night, is it safe for you to get up in the middle of the night? Do you have some issues with mobility that would affect you and you might have a tendency to fall because we're all half asleep? Sometimes you have to look at your caffeine intake. A lot of people have a tendency to drink more coffee when they're home because they're at the end of the day, they have had their supper, and they say, well, I'm going to have a couple cups of coffee. Unfortunately, caffeine does make you go to the bathroom more often than you need to. So sometimes you have to look at, do you have an infection in your bladder? Maybe this is just a signal to say that something's wrong and you might have an infection. So sometimes you might have to go get a culture done or a routine urine done just to see if there's anything there. Sometimes you have to start small with the little things and then grow from there. If this is a long-standing issue that is getting worse, we might have to refer you to a specialist, a urologist, who can do certain testing to make sure that you're emptying your bladder. And that's something that I would like to talk to all my patients about, making sure that they do empty their bladder. Because sometimes you just don't take the time off, of your busy schedule to go to the bathroom in the daytime like you should. And sometimes at the end of the day, when we're drinking, then we realize, oh, I haven't gone to the bathroom all day. So that could impact your having to go to the washroom at night. Unfortunately, too, if you don't get your proper sleep, you're getting interrupted sleep by going to the washroom. That will make you feel tired the next day, so you get other symptoms on top of just not your bladder issues that you have ongoing. So overall, you need to sit down and do a review of things that have changed. Maybe it's just happened so infrequently, because sometimes people just have to go in the middle of the night for no specific reason, whether you have MS or not. Or is this a signal of something underlying that we have to address earlier than leaving it at a later date?